is going to be a very significant issue that you're going to face that in previous times administrations just ignored and did not enforce.
Senator, I hear you very clearly. And as I said, I will respect the law as HHS Secretary.
There are multiple grants and aid that's out there that there'll have to be decisions made over whether faith-based entities can get grants or aid at the same level as non-faith, excuse me, non-faith-based entities. Excuse me. Here's the challenge. In some previous administrations, if you're a faith-based entity, you were not allowed to participate strictly because of your faith and the structure of that. Supreme Court has now stepped in pretty clear decisions over the past several years to make it clear you can't discriminate someone on the basis of their faith. Will you make sure the grant and the aid proposals from HHS are equal for faith-based entities and non-faith-based entities for the same issues?
Again, you raised the issue, regardless of what your perspective is, right? Wherever we all may fall on these issues, at the end of the day, we've got to make sure, at least I do, if I'm fortunate to be the Secretary of HHS, I have to follow the law. And there I will tell you that we will make sure that we are following the law.
Thank you. Mr. Chairman, I'd like to ask for 4 different letters to be entered into the record that folks have sent to me and to other members of this committee.
Without objection, that's so ordered. All right. Our next colleague is Senator Brown on the web, and I see Senator Daines here, so Senator Daines would follow Senator Brown. Senator Brown.
Thank you, Mr. Chair. General Becerra, good to see you. Thanks for your willingness to serve as Secretary of HHS. Thanks for your commitment through your whole career, because I've known you a long time, to reducing health disparities and prioritizing policies to address the social determinants of health. A number of communities in my state have passed resolutions declaring racism a public health crisis. I think it's important that we know that the history of institutional racism continues to impact health outcomes for communities, and it's particularly important that you understand the urgent need to be intentional about your work, and I know you will be. So thank you for that. Cincinnati is home to 2 CDC NIOSH facilities, National Institute of Occupational Safety and Health. They are unlike any facilities in the country, maybe in the world. Their focus is occupational injury, repetitive injury, occupational health, generally toxins in the workplace, all of that. In 2015, Secretary Burwell announced that HHS would be dedicating $110 million to consolidate and upgrade the current Cincinnati NIOSH facilities. They've in various degrees of disrepair the way CDC was a half a generation ago. CDC and GAO are currently undergoing site acquisition activities. I understand both the site purchase and a design build contract will be finalized this spring. It's moved entirely too slowly. There was indifference or worse from the previous administration. My request is simple, to ask if you would work with Senator Portman and me to ensure this project continues to get the attention it deserves from HHS, including the funding necessary to stay on track.
You have my commitment to that.
Thank you, General. In recent years, Congress and HHS have expanded the scope of benefits available to those who are enrolled in Medicare Advantage plans without doing the same thing for those individuals who choose to remain in traditional Medicare. We've added benefits, vision, dental. We removed barriers to care like the 3-day stay rule for skilled nursing facility care for Medicare Advantage beneficiaries, but failed to extend, that's the more privatized Medicare, if you will, but failed to extend those same advantages to those seniors that stay in traditional Medicare plans. And those seniors typically are a little older and a little sicker and a little poorer generally. The growing imbalance between the programs concerns me greatly, especially when the Medicare program's been spending more money per Medicare Advantage plan enrollees than on people who choose traditional Medicare, a relatively recent but inexorable move in that direction. My question, General Becerra, will you commit to using your authority to holding private insurers accountable in reining in those Medicare Advantage overpayments to ensure taxpayers and all Medicare beneficiaries are getting their money's worth?
Senator, you have my commitment in terms of dealing with Medicare. You're right. We don't have the dollars to spare and to waste. And so in this process of trying to strengthen and improve Medicare, we have to make sure we're doing oversight and keeping everyone accountable. And so I absolutely agree that that's going to be one of the principal responsibilities we have. We have to be good stewards of the Medicare program, taxpayer dollars. And as you mentioned, with this 3-day rule for post-acute care, there are ways that we have to make sure that we're keeping everyone honest, and I will make sure that there is a level playing field.
The level playing field here is so important. In closing, one last point, Mr. Chair, General Becerra. I'd like to, I want to bring forward to you the issue of the priority of bringing down the high cost of prescription drugs. Let me share a story quickly with you from a constituent in Columbus area community called Pickerington, from a young man someone named Colton. He was diagnosed with ulcerative colitis in 2014. When his insurance coverage changed 2 years later, he was forced to pay $1,200 every 4 weeks for the infusions that kept his disease in remission. I just want to read you his comments briefly. At the time of this cost increase, I was in college, was already feeling the financial burden of student debt. Budgets for students are already tight enough, but the immense increase in cost for my infusions left me in a very difficult position. Unfortunately, with the added financial burden for my infusions, I had to choose between affording the cost of my infusions or school. This decision wasn't a decision at all, since I needed the infusions to stay alive. The unreasonable price of my prescriptions forced me to leave college. My life path, he writes, has been completely altered by expensive prescription drugs and drug company greed. I often feel like I'm behind all of the people my age, even people younger than I, because I've had to focus my time and my money on staying alive. We shouldn't have to give up on pursuing a college education because of crippling medical debt. We shouldn't have to make every financial decision with the cost of prescriptions and medical debt in the back of our minds. Things can be better if our leaders rein in drug company greed and make the needs of patients like me the priority. That's the end of his letter. Now's the time, General, for meaningful reforms to bring down drug prices. My question is simple. If confirmed, will you commit to working with me and other members of this committee, especially Chair Wyden, who's been so involved in this, to deliver real change that will make American prescription drugs more affordable?
You have that commitment.
Good. Thank you, General. Thank you, Chairman Wyden.
Thank you, Senator Brown. We will be working on that. Senator Daines.
Thank you, Chairman Wyden. Attorney General Becerra, I just want to be up front and tell you, I've got serious concerns with the radical views that you've taken in the past on the issue of abortion, as well as one of our very important constitutional protection, that is religious liberty. Frankly, a record that shows a disregard for that. Our present challenges demand an HHS secretary that is prepared to combat the COVID-19 pandemic and command a position of public trust. Many Montanans, pro-life groups across the country have written to say that you have taken the most radical positions on this very important issue of life and on abortion. If you want to push back on that impression, I think you have an opportunity here to try to gain some public trust and to take a look at the record you've had in California and how you might govern if you are approved here in Washington, D.C. Could you name one abortion restriction that you might support?
Senator, let me try to respond this way. I have tried to make sure on this important issue for so many people, where oftentimes, again, we have different views, but deeply held views, that I have tried to make sure that I am abiding by the law. Because whether it's a particular restriction or whether it's the whole idea of abortion, whether we agree or not, we have to come to some conclusion, and that's where the law gives us.
But is there, just to be clear, is there any line you would draw? Is there just one restriction as it relates to abortion
So
that you might support?
Senator, you're talking to the spouse of a OBGYN who for decades has practiced saving lives of women and babies. And I can tell you that from the stories I've heard from Carolina, my wife, I know how hard many women struggle just to save the life of their baby. And so what I would say to you, and I know that right now as I speak, my mother has blessed me this morning as I got ready to come here. And last night, I know when she prayed the rosary, as she does every day, every evening with my aunt, that she said a prayer and included me in that
Well,
prayer.
there's, part of it's the battle for those who don't have a voice, which are the little babies. And you didn't answer the question about even one restriction on abortion. I didn't get an answer from you. Let me just throw one out there. How about a ban on the lethal discrimination of babies who are diagnosed with Down syndrome?
And so, Senator, once again, if I can simply say to you that I respect the different views that are out there, but what's important is that it makes sure that
Yeah,
it's,
but
my view is according to the
You're
law.
going to, if you confirm, you're going to be the head of the HHS. It's a huge organization, has profound impact on our society. How about a ban on sex-selective abortion? Whether the little baby is a male or a female, would you say you can't have a sex-selective abortion?
And I respect those who take a particular view. My job will be to make sure that I am following the law.
There's a ban on partial birth abortion. I know that question came up yesterday. Is that yes or no? Would you support a ban on partial birth abortion?
Again, Senator, you're asking questions which will touch on aspects that I know have different views. And what I can say is that I will make sure that I'm respecting the law on those issues.
You've repeatedly intervened in court to revoke an important religious exemption to Obamacare's contraception mandate from people like the Little Sisters of the Poor, an order of Catholic nuns that serve the poor and are most vulnerable. And they have won at the Supreme Court. As HHS Secretary, would you commit to defending the existing regulatory exemptions to the contraceptive mandate, or will you seek to eliminate the exemption, protecting the Little Sisters of the Poor from crippling government fines?
Well, as you mentioned, the Supreme Court issued a ruling. We'll make sure, as if I'm fortunate to become Secretary of HHS, that we will abide by the law as it stands. And now with this ruling from the
So you would defend the existing mandate then, per the court?
I will defend the law and support the law that's in place.
According to CDC data, they've been comparing states and territories. Montana's ranked near the top for administration of the vaccine, but we fall near the bottom for first doses allocated by the federal government. That's why our congressional delegation wrote to President Biden expressing frustration that Montana isn't getting its fair share of vaccines. I'm concerned HHS is neglecting to reward states like Montana that could administer at least 3 times the number of doses being delivered currently. Do you believe HHS should provide additional vaccines to states like Montana, for example, who've been able to quickly and efficiently get vaccines in the arms of people who want them?
Senator, we applaud states that are moving forward and being diligent in getting their people protected. And I know that President Biden has made the commitment to have all the vaccines that we'll need throughout the country. And what I can commit to you is to make sure we're working with you and the folks in Montana to make sure that the vaccines are there for the people of your state when they need them, and doing that for the same way for all the people in this country. We want to make sure we're not missing anyone, and that's where this issue of pockets of populations.
Thank you for that and appreciate that answer. Last question. You're on record for pushing for allowing illegal immigrants to receive taxpayer-funded health care and for decriminalizing illegal entry in the United States. This, coupled with President Biden's radical plan for granting citizenship to those who are here illegally, would potentially lead to hundreds of thousands, if not potentially millions, more people flooding into our country. As you know, in 2016, California passed a law requiring covered California to apply for Section 1332 waiver to allow illegal immigrants to purchase health insurance through the marketplace. This waiver was withdrawn after President Trump's election. My question is this: will you attempt to use the waiver authority contained in the Affordable Care Act to grant health care benefits to illegal immigrants?
Senator, what I can tell you is that where the law, as it stands now, as I see it, it does not allow those who are unauthorized in this country to receive taxpayer-paid benefits, except in very rare circumstances. And it will be my job to make sure that we are following and enforcing the law. And I can commit to you that that's what we will do.
Thank you.
Senator Bennett.
Thank you, Mr. Chairman. We turn to another. It's very nice to see you, Mr. Attorney General. Welcome back to Washington. And I want to turn to what was also called a radical plan, and that was the Affordable Care Act, which has made massive strides in providing health care to 20 million Americans, protecting people with pre-existing conditions from discrimination and a lot of other things that have become the norm in this country, like staying on your parents' health insurance until you're 26, something you couldn't do before the Affordable Care Act. was passed. I think we need to build on the Affordable Care Act and use the Medicare system to provide a true public option. And it's something that the president has also talked about in his campaign. I believed in it when we passed the ACA to begin with. The votes weren't here to do it. I think it's become very clear during the course of the pandemic that nobody is served by having people that don't have primary access or to access to primary health care, because you can see in the numbers in the pandemic what's happened to this country versus some other places. Last August, then candidate Biden was speaking to one of my constituents from Colorado, Laura Packard, who was told the vice president at the time that she was literally receiving chemotherapy on the day that there were some folks here trying to repeal the Affordable Care Act. And she asked her what he was going to do for people like her and for, people in America. And he told her, quote, "We're going to provide a Medicare-like option as a public option." He went on, "I'm going to protect you like I try and protect my own family, and I promise you that." It was a powerful moment for all of us who were watching. And yesterday, Senator Tim Kaine and I and some of my colleagues on this committee reintroduced the Medicare X Choice Act to create a true public option, increasing choice for consumers, starting in rural areas, reducing healthcare costs, and increasing affordability and quality of health insurance. We work to ensure that our updated legislation aligns with President Biden's plan, including plans offering primary care services without cost sharing, fixing the family glitch to increase access to premium support, and ensuring that the cap on premiums for everyone above 400% of federal poverty level is 8.5% of their income. Medicare X both finishes the work of the ACA and aligns with the president's objectives. You are uniquely situated, having been both a lawmaker and the California Attorney General, to help us get this across the finish line. And I just want to ask what your thoughts are on the commitments the president made on a public option during the campaign, and how we can get it across the finish line so we can finally fulfill the promise that every single American has access to health care in this country.
Senator, you've pointed out where now President Biden stood as candidate Biden, and he was very strong about this. He made it very clear that the Affordable Care Act is a strong foundation from which we can build. You've mentioned the public option. He made it very clear he's a supporter of moving forward on a public option. My job will be to try to implement the president's agenda on healthcare. And so I will look forward to working with you and all of your colleagues to try to make sure we can continue to see more Americans access healthcare, whether through their employer or whether through Medicaid or whether through the Affordable Care Act's marketplaces. We need to have those options, including the public option, available. If states want to move in that direction, we will try to we'll work with them as best we can. But as you said, the goal here has to be to make things even better, more affordable for Americans.
Mr. Chairman, I came up with the idea for this legislation after I was in a meeting in Jackson County, Colorado. And to give you a sense of Jackson County, I saw my friend from Indiana. I had to start the meeting by apologizing for how badly I had done in the election the last time, because it is, there are very few Democrats there. And somebody actually said, "Oh, you actually won a few more Democrats than there actually are." But it was grim. But I was there, and somebody said to me, "Michael, I moved back to this town. It's a county with, I think, fewer than 1,000 people in it. Huge. But I moved back to this town to take over the bowling alley that I loved to go to as a kid. And I'm working 50 hours a week. My wife is working 50 hours a week. Neither of us has health insurance." He said, I've got people I want to hire, but I can't hire people because they have to give up their welfare to come work for me." I said, "What do you mean their welfare?" He said, "Their Medicaid. In other words, their health care." So here in America, this is after the Affordable Care Act was passed. Here we have a situation where small business owner and his wife are working 50 hours a week. They can't afford health insurance. Folks that would want to come work can't come work because they have to give up their insurance. How can we defend a system like that? And we don't need to. And I hope we look back at the history of all of that and find a way to put the partisanship aside and actually provide the American people with just what this is, an option. They can choose. They can choose all over rural and urban Colorado. It'd be a choice. If you want to stay with your private insurance, stay with it. If you want a public option administered by Medicare, you can have that too. And I think that's going to be a powerful argument for the American people who, coming out of this pandemic, want more choices, not fewer. So I'm very glad you've been nominated, and I look forward to supporting your nomination and working with you to deliver this for the American people. Thank you, Mr. Chairman.
Thank you, Senator Bennett. Senator Young.
Mr. Becerra, there are all sorts of concerns by my constituents and I think every American about getting shots into arms as quickly as possible. That is my foremost objective in trying to support the administration in furtherance of that goal. The Biden administration just announced the launch of 2 new federal programs, the Federal Retail Pharmacy Program and the Community Health Centers Vaccination Program. This was an effort to speed up vaccinations across the country.
Yes.
These programs are in addition to an existing program, which is the Pharmacy Partnership for Long-Term Care program. Unfortunately, these various programs are causing some confusion for the states, as the states aren't able to oversee and coordinate distribution of our already limited supply of vaccine with these various entities, long-term care facilities, community health centers, retail pharmacies. And individual Hoosiers are confused as well, because now they have to sign up in multiple places in order to become vaccinated. In fact, the National Governors Association recently wrote to the administration highlighting this issue, indicating, quote, if the federal government distributes independently of the states to these same entities without state coordination and consultation, redundancy and inefficiency may very well follow, unquote. I'd like to submit 2 letters for the record, one from the NGA and one from my home state of Indiana, further detailing these concerns, Mr. Chair.
Without objection, so ordered.
So I bring this to your attention because until adequate supply is available, Mr. Becerra, the administration should be working with states on vaccine distribution, especially since retail pharmacies and federally qualified health centers are already part of many states' vaccine plans. And the state of Indiana has been making great strides with the available vaccine to get into the arms of Hoosiers. So do you commit to working with the states before announcing major program rollouts like the 2 I mentioned in the future?
And Senator, you'll understand why this is close to my gut more than my heart, because I'm a state official right now. And we've had to administer a lot of these programs. I've had to defend many of these programs in our state level in court. And what I will say to you is that if we're not doing a good job of coordinating with our state and local and tribal and territorial partners, then we're not doing doing it as well as we can. And so I am committed to working with you to make sure that as we get the product out, and fortunately, President Biden has made an aggressive effort to make sure we have enough vaccines for everyone, that we're working with all those who have to make sure that shot actually gets into the arm.
So that's an encouraging response. Let me go further.
Sure.
Would you allow states like Indiana, who may well find these programs counterproductive to our shared goals of getting vaccine into arms, to opt out of these federal programs until a time where there's adequate supply available?
So let me, I'm not there yet there, and I hope to be confirmed, but it'd be tough, Senator, to be honest with you.
Would you consider it?
Absolutely. We'll sit down with you and talk. If the moment I am in that seat, I will make sure that we are sitting together. We'll go to your office and we'll talk about this.
Can you conceive of a reason why you wouldn't allow a state like Indiana to opt out of these programs?
I will tell you that the president's goals are ambitious. We want to move quickly. I can't understand why we wouldn't want to always coordinate, but I also want to make sure it's clear that the president has been very, very transparent in saying that we want to make sure we're reaching everyone. We're doing it in a fair way.
Okay.
And we're doing it in a, it makes sense.
I'm gonna cut you off. You know how this goes. I got a limited time.
Yes.
But I would hope you would allow states like Indiana to opt out if that will help us get more vaccine in the arm of Hoosiers. So 33 Americans die every day waiting for a life-saving organ transplant. We have an organ shortage in this country, and it results from a severe lack of oversight and accountability among government monopoly contractors that run our organ donation system. These are known as organ procurement organizations, or OPOs. The Senate Finance Committee recently noted that our organ donation system has been severely underperforming for decades. Department of Health and Human Services finalized a rule last November that would allow HHS to hold OPOs accountable for their performance for the first time in its 40-year history. This rule is projected to save more than 7,000 additional lives every year. And it's going to save money too, over $1 billion annually to Medicare. But because this rule was finalized in the last 60 days of the previous administration, you know where I'm headed with this. It's currently being subjected to the Biden administration freeze on midnight regulations. So as HHS Secretary, will you commit to implementing and enforcing the November 2020 OPO final rule swiftly and forcefully as soon as the review period ends?
So first, I got to say thank you for the role you've played on organ donation. It's critical. It's not a subject everyone wants to take on. Secondly, there's a pause. The pause that the president put on a number of these rules is something that most administrations do, but I can guarantee you that the administration, if I'm fortunate to be confirmed, HHS will work quickly to try to get back up to speed on some of these different rules. What I can commit to you is this, is we all know we need to increase the supply. We know we have to be fair. We have to make sure we're doing this in a way that makes sense, and we have to do the oversight. And so I can commit to you to work with you to make sure that once I get in the chair, if I'm fortunate to be confirmed, that we will talk to you about how we move forward with that rule and, of course, your legislation as well.
Thank you, Mr. Attorney General. Let me also say to my colleague and to those following this, I think these are very important issues. And we have had a bipartisan inquiry going on in this committee where our colleague has been very actively involved. We will be continuing that. It is really high priority matter, and my colleague has laid out some of the problems, and we're going to want to get into the details, I believe, when the Attorney General is confirmed, and I was appreciative of his positive answers, so I thank you. Let's do this. If there are any senators waiting in the queue on the web, we will take one more before we go and vote. And then otherwise, per an agreement with both sides, we'll take a 15-minute recess. Mr. Attorney General, are any of my colleagues waiting on the web to ask questions? All right, I gather not. So it is a little after 4. We'll take 15 minutes and we'll have a recess, and we'll be back at that point. Oh, Senator Casey. Okay. Senator Casey, you're out there in cyberspace somewhere?
I didn't think I'd have a chance, Ron.
Terrific.
Mr. Chair.
Terrific. Okay.
So much.
We will revise the state of play here, and we will hear from Senator Casey. And after he has completed his questions, then we will take a 15-minute break, and that is in accord with the wishes of both the majority and the minority. Senator Casey.
Thanks, Mr. Chairman. I think I may have jumped ahead. So I want the Attorney General to know this has never happened before. So let me use my time wisely. Mr. Attorney General, thank you again for your public service and your willingness to continue public service on behalf of the nation by running a major agency of our government that's so important these days, and that's the Department of Health and Human Services. And I also want to thank you for the commitment of your family, which I know is a major commitment by any family when you're in public service like you've been all these years. And yours is a great American story. I wanted to start with the issue of home and community-based services. We know that one of the real tragedies within the larger tragedy of the pandemic, now that we've reached that awful, awful number of 500,000 deaths, is a high percentage of those deaths, at last count more than 170,000, residents and workers dying of the virus who were in nursing homes, living or working in nursing homes or other long-term care settings. One way to protect these populations with is with a responsive and
robust support system that provides quality home and community-based services. We know that those who do this work in the home or home and community-based services, as well as in the long-term care setting, are frontline workers. They're heroic. And the folks who do this work support older adults in our communities, and they also support and provide care for folks with disabilities who need that help. They're often paid about $12 an hour for this essential work. Most of them, a high percentage of them, are women of color. And because these home and community-based services are not required under Medicaid, under current law, there's over 800,000 people on waiting lists for these services, 16,000 of those in Pennsylvania. So we need to invest in this option that we haven't really made part of Medicaid in a substantial way other than the waiver program. We need to invest now. The House legislation, their COVID-19 bill has over $9 billion. This is but a foot in the door, but a very important, unprecedented foot in the door. So I have two questions for you. First, upon the passage, and I'm being optimistic here, but I think it'll happen, the passage of this emergency funding legislation, COVID-19 legislation, as well as the funding for home and community-based services, will you work to distribute it to the states as quickly as possible?
You've got my commitment, Senator.
Thank you. And then secondly, as you know, the next matter for President Biden and Vice President Harris is to work on the Build Back Better plan. And that's another opportunity, I think, for us to really focus on this issue, but provide an even more substantial investment in home and community-based services. And I hope you would work with us to secure that funding.
You've got my commitment again to work with you on that.
The last issue in my remaining time is Medicaid. I don't have to tell you, because you've been a strong supporter and a fighter to preserve Medicaid funding. Medicaid, in so many ways, isn't some program. It tells who we are. It tells us who we are, and it tells us whom we value, whether it's kids or seniors or people with disabilities. So many millions of Americans, 70 million plus at last count, have the benefit of Medicaid. You were familiar with when we sat down most recently and in our last hearing in the Help Committee with my agenda for children and the 5 freedoms for America's children. I believe every child at birth, if they don't have health care coverage, should be covered by Medicaid. And I just want to ask, how will you use your authority as HHS Secretary to utilize waiver authority and other tools to strengthen Medicaid and to help expand coverage to uninsured or underinsured Americans?
Senator, I know you know this, so I'm just repeating what you've already worked on so much, and that is Medicaid as the lifeline. It is what's kept so many American families from losing all hope, and in many cases, losing respect. And so I am absolutely prepared to work with you and many of your colleagues to try to do what we can to strengthen Medicaid, because for so many, including seniors who have Medicare, who oftentimes rely on Medicaid as well, we have to make sure that we don't lose sight of how important Medicaid has become to the entire population. And with the president's commitment to continue to build on the Affordable Care Act, Medicaid, as you know, is indispensable. So ready to work with you on any issues, especially for children. And I know my wife is applauding everything you've just said to try to make sure our children have opportunities from the get-go.
Thanks so much. We look forward to your confirmation.
Thank you, Senator Casey. We're calling
Thank you, Mr. Chairman.
We're calling some audibles here, and with the consent of both sides, we'll have Senator Whitehouse, and then all other senators should know we're going to take a 15-minute break, and then we will finish. Senator Whitehouse.
Welcome, Attorney General.
Senator.
It's great to see you, and I wish you every success in the remaining days of your confirmation process. I want to mention 2 things to you that I've put a lot of work into over time. One is delivery system reform in our healthcare system. Macro, we hit the Medicare Trust Fund in 2024. And so we're going to have to deal with that issue between now and then. Micro, Rhode Island has 2 of the best accountable care organizations in the country. These are primary care provider groups, doctors' practices that have got together early, signed up as ACOs under the Affordable Care Act, and have changed the way they practice. And as a result, their cost per patient is coming down. Their patient satisfaction is through the roof. Their outcomes are improving, and they're sending checks back to the federal government out of the shared savings that they've been able to obtain. My staff person will hand you a little graph that I've got a big copy of right here, which is something that I've worked on for a while as time has gone by. In the far left here, time begins around the time we passed Obamacare. And at that point, CBO projected what federal healthcare spending was going to look like. And their projection then is that top line. But in fact, with Obamacare law, we didn't follow that trajectory. Costs were actually lower. And as we've gone forward, we've experienced actual costs that are that bottom line. And the current projection, matching that original one from 12 years ago, I guess now, pushes out from where we are at now out 10 years. But if you took that same projection and put it onto where we were before, here's this gap between what was predicted and what we've achieved. And in the next 10 years, that gap is $6 trillion. Something changed from what was anticipated at the time we passed Obamacare, and the savings in the next decade are going to be $6 trillion from whatever that thing was that changed. I think that what changed was getting away from fee-for-service, getting providers engaged in accountable care organizations, and the emphasis on quality and reducing medical errors and dealing with patients better. So I've had my rows with the Obama administration over how they were doing ACOs, and I've had my rows with the Trump administration. And I want to work with you to make sure that these organizations that are basically breaking trail for the rest of the healthcare system, these leadership ACOs, are getting the support and the encouragement that they need, because when they win, we win. And with Medicare Trust Fund starting to hit its limit looming, we got to get serious about that. And I don't need a long response from you now, but I want to make sure you're aware of the opportunities for delivery system reform. And I know you've got some very good ACOs in California as well.
Yes. And Senator, if there's a response there, I'm looking forward to working with you on it.
We will, because we got work to do. It's also very likely a big political win-win. I don't know anybody on any side of any aisle in Washington who doesn't want better care, producing lower costs with happier patients. Last point, this is a bit of a personal thing. I've been working for a long time on having us treat people at the end of their lives better than we do. Making sure that their choices are respected, making sure that their capability to be at home at that time is respected, make sure that they're pulled out of the hospital treadmill and they aren't dying in intensive care units that they don't want to be in and shouldn't be in. We've worked with CMMI a lot on that, and I'm hoping that we can close out under your leadership through the Center for Medicare and Medicaid Innovation a pilot program that will show that when you treat people at the end of their lives with more humanity, everybody's happier and it saves money. Will you work with me on that?
As someone who had his father live with him the last 3 years of his life, so that when he passed in his bed in my home, absolutely. I look forward to working with you on that.
You and I have had the same experience then. Thank you, sir, and Godspeed in your confirmation.
Thank you, Senator.
Thank my colleague, Mr. Attorney General. We'll take a 15-minute break.
Thank you.